Eighth early stage company, GoCrew Health, Portland, Oregon based. They are a white labeled HIPAA compliant communications platform that allows healthcare providers and patients to communicate easily and effectively. Thank you for joining us virtually, GoCrew Health.
Hey there, can you all hear me?
Yes. Go for it, David.
Awesome. Hey, humbled and honored to be here. I'm Dr. David Spiro. I'm the CEO and founder of GoCrew. I'm a children's ER doctor. And healthcare is complicated, and communication is the essence of healthcare. And what GoCrew does is it just makes it simple. Last week, we were in a meeting with about 15 public health nurses representing 20 counties in California. And one of the foster care nurses said that a child actually passed away because she actually couldn't access the family. You know, we're talking with public health entities that don't use any HIPAA compliant methods or actually don't have access to patients, public health nurses, peer counselors, and there's so many areas where it's just not working well. And those public health nurses told us something that was incredibly, we were honored to hear, is that GoCrew is a need to have and not a nice to have in healthcare. So what are we? We're HIPAA compliant, we're white labeled, sets up in a few minutes for both patient and provider. We do in-app texting, telehealth that also transcribes. We actually send video files, both synchronously and asynchronously, to help with the education of the patients. And most importantly, we're provider mobile. So providers, healthcare nurses, even physicians are not practicing in the office as much anymore, and so they can practice wherever they need to. We're living in a mobile environment, and most importantly, we have an incredibly beautiful and simple native app, iPhone and Android user interface. We are not a narrow telehealth solution. One of our competitors that does half of what we do just got acquired for $200 million, Clara, K-L-A-R-A, Clara. So where are we today? We have a live product with live apps in the iPhone and Android store. We launched a few months ago. We have some paying customers. Some of our customers are athletic trainers, peer counselors, and clinics, and we have deal discussions with a number of larger entities. We're really, really bullish on public health entities. We have an experienced team. We have an active board. We're planning a price round at some point in the very near future once we get a few these larger deals done that are in the pipeline. And I just want you to remember the name GoCrew. We're just going to modernize healthcare by making it simple. Healthcare is complicated. Communication is the essence of healthcare, and we're just making it simple.
I love the sound.
I'm honored to be here. Thank you.
I love the sound of that. Thank you for being here. Jen, I think you're ready.
Dr. Spiro. So for those of you who haven't met him, Dr. Spiro is a pediatric ER doc. He literally saves babies as a job, and has elected to go into healthcare software in order to do that better. So I guess my question is, aren't there tools that already allow physicians and advice nurses to contact patients through the phone or using the horrible MyChart system that all of us are so familiar with? Why do we need something else, and how does this make it faster and better?
I had an appointment with my doctor through MyChart and Epic, and it took me 30 steps using portals, emails, and phone calls to get in front of my own doctor. Everyone's complaining about it in all sorts of different ways. And where we're going to start, one of the other users said this, where our beachhead is in the public health space, where they're literally just using their cell phone to communicate in a non-HIPAA compliant way, or not communicate with their patients. And so Jen, yes, there are telehealth solutions. Many providers use Zoom, which is frankly it's a point solution, but it's not so mobile, and it's not integrated, and it doesn't do a number of the amazing things that our app does, which is super simple and native to the iPhone and the Android.
Steve, do we have a question from the audience? Or I'm going to Steve, guys. I'm going to Steve. Hit it, Steve.
Steve's always got a question. Can you talk a little bit about how your capabilities have to integrate with existing legacy systems associated with these practices?
Well, most of the entities that we've already that are paying customers are not seeing a massive need for it. For some of our larger entities, we're API driven, so we have the ability to easily integrate with existing electronic health record systems as long as they're API driven. Super simple.
That's amazing. Any other questions from the audience? Okay. Jen, you have one?
Yeah,
okay.
I'll take one more. So the GoCrew system allows public health nurses and physicians to communicate with patients. So tell us more about what that actually means. Can I text them? Can I video call them? Can I email them? How does this help a public health professional stay in better contact with a patient?
Yeah, so again, it's in-app texting, there's notifications, there's video chat, and most importantly, I just mentioned it briefly, Jen, we are really bullish on the use of synchronous and asynchronous video. So at the end of a telehealth session, you press a button and you're recorded, and that video is sent right to the family. So there's no doubt about what that provider is saying at the end of the call. It's recorded, let alone each entity has its own drive that they can send asynchronous video recordings. We are super bullish on the use of video, which is not used in healthcare. And it's one of the most differentiating aspects of what GoCrew provides.
Wow. Steve, it looks like you have another question.
Yeah, I just got to follow up on that.
Oh,
So,
and Deanne has one too. Is there
Is
a
there
translation?
There is translation, and most importantly, there's transcription. So every
Beautiful.
single telehealth session is transcribed, and that would be a very, very good use case at a large-scale entity to have an API-driven EMR connection to be able to ease the use for the providers to have that transcription available. So it's fully documented.
Wow.
Many of the public health nurses we spoke to said they can't document a lot of things, and this is an incredibly simple tool to allow them to document
Wow.
the time that they're using to communicate with their patients.
This is incredible. It seems like you've really thought of everything. So I'm wishing you the best of luck. Thank you for joining us.
Thank
Please
you.
keep us
Honored to be here.
posted. Yeah, thanks for being here.